All right, what we're doing is we're going to do assessment and treatment of an injured firefighter on scene. This is the kind of stuff that will take place after your rapid intervention team had gone in, retrieved your injured firefighter and brought them out, or lowered them down from the structure, whatever the case may be. What we're doing tonight is predominantly going to be geared toward the injured firefighter versus the medical firefighter. Of course, no two scenarios are going to be the same. Keep in mind that if a firefighter is found down and it was not witnessed, you always have to assume C-spine injuries, and you always have to assume that there is going to be trauma involved. In the event of an arrest, then of course you're going to have to rapidly expose the firefighter to do life-saving measures, to take care of whatever those circumstances may be. Dean's going to be our subject tonight. He's going to be our down firefighter. This is going to be your typical presentation for a firefighter. He's going to be brought out, he's going to be laid down in the driveway, laid down in the yard, and that's how he's going to present. All right, Dean, just lay down on the ground. Who are my responders going to be? Brett, you want to jump in since you're a medic?
Firefighters, man.
Mike's the basic.
I'm not there yet.
Come on, Charlie.
I'm not there yet.
Come on.
I'm his partner.
Come on, you can help. We got to have another guy. I got a knife.
There you go. That'll work.
That qualifies me for anything.
He's breathing.
Okay. What you're going to do now is you're going to want to go ahead and maintain his C-spine just like you would with a motorcycle. Okay? Mike's going to put his hands on the side of his head. Roll his head into a neutral position. You're going to ask him if he's conscious.
Dean, are you conscious?
Dean, you're going to be a conscious firefighter, okay?
Yes.
But you're injured.
Conscious firefighter.
All right, he's breathing, he's able to talk to you. All right, he's gonna tell you where he's hurt. We're just gonna assume full spinal immobilization.
Where are you hurt, Dean?
I really wish we had an EMT or a medic in here.
His spine hurts.
Thank you. All right, we're gonna let Brett assume assessment. What I'm gonna do is I'm gonna talk you through going through the removal of the gear. Okay, Mike, you maintain C-spine. All right, Brett's going to undo the straps on the belt. I'm sorry, yes.
That's fine.
Undo the straps on his helmet. Yep. All right, now you can pull the helmet right on off. Mike's going to maintain C-spine. Yep. Okay, now, what you want to do now is you want to undo the collar. And what that's going to do is that's going to allow Mike to maintain C-spine by putting a hand underneath the back of Dean's head and putting his hand up under his chin. Hold up. Mike, get your hands up under his chin.
Yep.
Push the collar right under the. Now we're not going to cut his hood because his hood is fairly new, and we don't want to cut that. All right. Now what you would do is you would cut the hood. You'd come right in here to the opening here, and you'd cut this hood from the bottom of this opening all the way down, and you'd pull it straight off the top of his head. All right, and it would come straight off. And what that would do, of course, is it would expose all the straps on his face mask. Then you have the option of either loosening those straps to take them off, or just cutting them and going ahead and removing his face mask. All right, then you've got access to his head. His head is clear. All right, so let's just go ahead and remove his hood, pull his hood back, take his mask off, and we'll just go ahead and pull the hood right off and out of the way. That way we're not sacrificing a $40 hood and the straps on our air pack.
Oh, come on, you're the phone.
I know.
Tell me that a little bit wrong. There we go.
All right, now what Mike can do is he can roll his hands back around to the side of Dean's head to maintain C-spine. The firefighter's still lying supine, he's still tilted over, all right, because he's laying on the bottom. Brett has already undone his waist belt. You can go ahead and undo the waist belt. these waist belts are so thick, you're not gonna wanna try to cut that with your trauma shears. This stuff is so super thick. Yeah, let's go ahead and turn that off. There's no need to try to cut that. There's no need to try to cut the upper part of these shoulder straps. Not only do you have the hoses in the way and the fittings and stuff, so whenever you go to cut these shoulder straps, you want to cut it down here on the thinner part. You can cut these things right off, okay? So you can just snip and cut them and they're out of the way. We're not going to cut our air pack straps. Dean, pull your arm right out of here.
You can loosen that strap, you might be able to.
There you go. Okay, now what you want to do is remember, you've undone your waist belt, you've cut this shoulder strap and pulled that strap out of the way. You still want to leave him laying on the bottom. Now, depending on which side he's laying on is which side you would do. It doesn't have to be left or right, doesn't make any difference. Now, let's get some trauma shears. You want me to get a pair of ours so you don't have to use yours up, Brett? I don't know what it's going to do to your shears. Just in case, I don't know what it'll do to them. All right, now what you want to do, you want to start at the cuff of the upside arm.
Want to remove his glove first? Or?
Yeah, just you pull his glove right off.
So now he's out of his air pack, but you still got him laying on the air pack.
He's still laying on the air pack, correct. And you'll see the reason for that here in a little bit. Now, of course, this would be the time, as soon as you get that hand exposed, go ahead and get a pulse oximeter on him. The fact that he's been in a fire, I would say you want to go ahead and put this guy on oxygen right out of the gate, you know, and just go ahead and have him on oxygen. You're not going to hurt anything with it. Just go ahead and let him have it. Now, what Brett's going to do when he goes to cut him out of this gear, look at the trouble he's having cutting this stuff. This stuff is thick. And you know what, Brett, if you don't mind, just cut it a little bit and let everybody get a feel of what that feels like. Here, I'll give it a shot. Let's let everybody get a feel of what it feels like to cut this stuff. Oh yeah. Definitely not like cutting regular material. All right, someone else?
Would be easier to try to cut on the seam.
I doubt it.
I don't know. No, I don't think, no, not on the seam
Not
definitely would not be any
I think it's
easier.
doubled there, isn't it?
That's what I'm
The
asking.
only
It's
reason
actually
we
like
cut
3 or
people's
4 layers
seams
of
for leather
stuff
and
there.
stuff so they can.
Mason will jump in there.
That's what I was
All right, now
thinking.
Mason, what I want you to do,
If you cut.
what I want you to do is I want
That's
you to
what I
cut up
was
to about
getting
here
at.
and then stop.
Here.
Yep.
And realistically, if you have to, once you
All
get
right,
through
that's
that
good.
cuff,
Stop
you can-
about right there. Now, what you want to do is you want to cut to just about even with the armpit, maybe a little lower than the armpit. You do not want to try to cut all the way up and across this. Turnout gear has got reinforced shoulders because we're always carrying stuff on our shoulders and whatnot. So this through here is going to be super thick material. What you want to do is you want to take a cut to the east and just start running right across here all the way over for this area. You want to go ahead and unzip the coat and then cut it straight across and right through the zipper. Watch out for Dean's clothes and for Dean's body in there.
Please. I know you spend a lot on your dog.
A lot on my body.
So you want to cut this
No.
flap off of here or
Just
just?
go ahead and cut all the way through it. That part's gonna be, see now, if you tried to cut all the way across the shoulder, the whole shoulder is just like that. So you're really gonna play heck trying to cut through all that stuff.
Right here.
Here, I can do some tension
Tension
on it for you.
on one of
Go ahead. See, you would never cut through that shoulder. There it goes. Okay. Now, you've got his whole right side exposed now. Okay?
Alrighty.
Now keep in mind, and this is, I'm going to take a step back here. Different air packs are set up different ways. Our packs, you've got, all of them have got that seat belt right across the waist. That one's easy to get out of. The shoulder straps are gonna be a little bit different on all of them, but all of them, the adjustable part is gonna be down low, and that's where you're gonna wanna cut them, is down low. They're all gonna be thicker up top side, because that's where your regulators, your hoses, and that's where all the padding is for comfort factor, because where it's hanging over your shoulders.
You can also undo these shoulder straps.
You can.
And then that.
Some of them, like MSA, has an upward shoulder strap also, okay? So you, depending on what kind of air pack it is, you may have to cut or undo that top side or chest strap. So that may need to be undone. Okay, what's that?
So I think Drager has them too.
Does Drager have them all? Yeah, I think they do. I think you're right, because Salvo's got them. Okay, now, what we want to do now is we want to go ahead and it's going to take a couple of guys to do this. Mike's going to maintain C-spine. Brett, you're the paramedic, so you get down here on the other side. And what we want to do is we want to roll him fully recumbent. Make sure you get down here on this side.
Something to mention too, Larry, is once you get this cut here, you could get in here and assess.
Yeah, you can assess his belly and all that stuff now, just the way he's laying right there. All right, whenever Mike's going to have the count.
His other arm isn't hurt, yeah, bring it in closer.
Mike's going to have the count to roll him.
Okay, 1, 2, 3.
We're going to roll him fully recumbent towards you, Mace. All right, now, what you want to do now is take this coat and shove it all the way down to the ground. Brett can pull the air pack right on up and out of the way. That strap would have been cut. Let's go ahead and pull his arm out of that if we can.
Good boy.
Yeah, just undo it, Mike. There you go.
Here, come back this way.
Oh.
All right, easy there.
That's how you do it, man.
That strap would have been cut, so the air pack, so Brett could have pulled it completely out of the way. Now you've got the coat pushed all the way down to the ground. This exposes his back so that Brett can check his back for any kind of C-spine injury, point tenderness, any of that kind of stuff. After he gets done, Mike can give the command to roll him back.
Right. Yep. 1, 2, 3.
All right, roll him back. Now, if you were going to backboard this patient, which you would have been, that would have been the time to go ahead and get the backboard under him. You go ahead and pull the coat off of him.
Try not to move his body quite that much.
Yeah, you're definitely going to want to. And now you want to go ahead and C-spine him.
Yep, C collar or what?
Uh-oh.
Now you want to go ahead and put a collar on him. We don't have to do that for his benefit. There's no need to. These straps can be undone. Now what these guys recommend is just going ahead and taking the boots off just like you normally would. And then cutting up both legs.
So that's okay, yanking on his legs like that.
You're going to want to be careful. You're going to want to be careful.
Well, I got that.
You know, but yeah, and a lot of it's going to depend on the presentation of the patient. Dean's conscious and alert. If he's not yelling out, "Hey man, that hurts," do what you got to do. As long as you're maintaining C-spine and his back and lumbar is good, then you know that's the main
If
thing.
he's got a busted ankle, his boots aren't anything to cut through. I mean, it's,
Yeah,
you just,
Right.
just peel it
yeah,
right away.
yeah. Those boots will cut easier than turnout gear will. All right, so let's go ahead and cut up his pant legs.
Somebody's got shears.
Yeah, I had him last. Yeah.
Now keep in mind that cutting up those pants legs, you probably don't want to come straight up that knee.
No, I don't want to come through this.
Right, you probably want to come off to the side, either, yeah, I would come out medial to it. Or lateral rather, excuse me.
I was thinking seams like the jeans, where after you get a good start,
You could rip it?
pull, rip.
You
Yeah,
think?
I don't know if that would.
I don't know if that would work on bunkers or not.
Nothing
And
about
it
it.
has totally different fabric.
Well, we're gonna give it a try, okay, Chuck?
You're not all the way through, Mace.
Yeah.
You're not even, no,
I
you're
know,
not.
I know. I just want to see if what Chuck's saying is.
You're not gonna
No
tear
way.
that stuff.
Doesn't feel like it.
No.
But that's something too, if you don't have the strength. to
Dude, man, your
Cut
feet,
through every layer, just.
honest.
Well,
Yeah, right, that's true too.
One individually.
Right,
No, I'm
Brett,
not
Brett just had a good
wearing
point. If
anything.
you can't cut through everything,
So-
cut through one layer and then go through the other layer. Might make life a lot easier.
Off the seam, it rips better. I think you still cut it, right? You're gonna go all the way up?
Yep.
Okay.
Somebody wanna get in here and give him a spell?
Shag that on the scissors.
Yeah. Try that.
There.
Yeah. I don't
That
know.
was close with the shorts though.
I don't know how you're gonna get around this pocket.
Cut right through it.
Yeah? Yeah, I mean. Okay, go. I can't put any tension on that.
No, you're gonna be through 5 layers of shit by
Yeah.
the time.
You go around it?
I'm gonna cut it out of the way. What the hell?
feeling for?
Just go around.
dropping shoes on me.
All right, Dean.
All right.
That's one layer. That's another. You all set?
Okay.
Yeah.
Now keep in mind, guys, that if
The last time we did this, we cut the guys.
if you had
We will
reason
charge you
to-
extra.
I'm good. I've never been circumcised. So.
Mason was the last guy, so.
Fortunately, I had enough extra to have it.
Well, that seam right there is tough on the bottom of the pocket.
Mhm. Wow.
There we go.
Wow. Who had the knife?
Me.
Say, I got my Leatherman with a saw on it.
We're almost there, man. I'll tell you what. Yeah, I'm gonna go in from this side.
Just want to do one layer at a time.
That's what I was gonna do.
It's coming up. A zipper.
Yeah. There it is.
And keep in mind, guys, this is something that, you know, if we've got the manpower on the scene, we may want to give EMS a hand doing this because obviously this is labor intensive.
Takes a while.
So
Okay.
if we've got, you're not gonna be able to knife, are you?
Nah.
You can't do that.
Scalpel, man. Why not use something that's sharp? I mean,
You
you're-
can't be digging
you're
around
inside
on,
and
you can't be
cut.
digging around on a guy with a scalpel. What are you, crazy?
Yeah, I thought you
He's
had-
passed out.
Well, what's your, you carry scalpels, right?
No.
You don't have a scalpel? What do you do with them?
Surgical cricothyrotomy.
So you hack on people with them. I'm just talking about cutting his pants, so it seems like it would work. You could reach down.
How'd you get through
inside.
that? How'd you get through that flap on the pocket over there, Rob?
We cut down the pocket.
Yeah,
Pocket's already gone. It's just
The
top
pocket's
flat.
gone.
I think we get through that. I think we'll probably just cut right through the flap first. You had 2 guys.
That makes life easier.
Yeah, if there's one guy. How bad does it suck to be the victim?
I'm nervous. Really nervous.
Oh, you're fine. We're not gonna cut you, dude.
No, I
And these are
wasn't
trauma
gonna
shoes.
And if we did, think of all the guys here doing
They're not gonna cut you much.
Bruce, you maybe, but not cut. You don't need that appendix anyway.
Okay. All right, so now, damn, there you got a shorts.
He's open.
So now you've got the guy fully exposed, you can check for extremity fractures. And keep in mind, you're going to do this quick. I mean, if the guy did take a nasty fall, you can lose a lot of blood from the long bone fracture. Better check them out and make sure that they're still okay. And he's ready to be packaged, bag-boarded, and carried on his way. All throughout this, you got to maintain good C-spine, you got to maintain good airway, you want to maintain level of consciousness, and as all this other stuff's going on, you want to have your people getting vital signs. Brett may be wanting to put him on the monitor, whatever else needs to be done. Patient care needs to be going on simultaneously while all this other stuff's going on.